Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the basics of migraines. A migraine is a chronic headache that affects people for anywhere from a few hours up to 72 hours straight. It's a complicated, recurrent headache disorder that is most common in women and those between the ages of 15 and 55. One interesting thing is that most become less severe and less frequent with age. 18% of women are affected, 8% of men. 30 million individuals in the U.S. have at least one migraine per year. Interestingly, every 10 seconds, someone in the U.S. goes to the ER with a headache or a migraine. 70% of those with migraines have a first-degree relative who suffers. If one parent suffers from migraine, there is a 40% chance one of the children will suffer. If both parents suffer, the chance increases to 90%. So there is a hereditary component. More than 90% of sufferers are unable to work or function normally during their migraines. There's a lot we don't know about what causes migraines. We know there's some genetics and there are environmental issues. We also know there's some imbalances in brain chemicals. We know that serotonin levels do drop during migraines. Low serotonin, which is a pain management chemical, can trigger a migraine by letting too much blood flow through the vessels that should be constricted, and that can induce a throbbing sensation and a migraine. So typical migraine triggers, there's a lot of foods that can trigger migraines. This can be aged cheese, red wine, beer, whiskey, food additives, cold food, citrus, MSG or caffeine, elevated stress, weather changes, strong scents like perfume or paint, having a ponytail very tight, exercise, poor posture, skipping meals, and even smoking. Interesting, a small silver lining is that there's no evidence to clearly substantiate that chocolate is a trigger of migraine headaches. It's a myth and also a godsend. Symptoms of migraines include often a unilateral head pain that is throbbing and aggravated by activity. An aura is a visual or sensory symptoms prior to the onset of the migraine, like photophobia or visual scintillation. 80% of migraines have no aura at all. There's no objective testing available. It's not like there's a simple test to put a patient through and say, aha, this read out as a migraine, or you can clearly see it. A CT or MRI scan is often performed to rule out badness, like a big tumor that's causing similar symptoms. But it's a diagnosis based on patient history and the pattern of the symptoms. A migraine diary can be very helpful as well. When making the diagnosis of migraine, the International Headache Society requires patients to have at least 5 attacks fulfilling 3 criteria. This may include a 4 to 72 hour duration, at least 2 of these, unilateral, pulsating, moderate to severe pain intensity, aggravation by or causing avoidance of routine physical activity, and then at least 1 of these, nausea plus or minus vomiting, and then sensitivity to sound or light, which is photophobia and phonophobia. There are several abortive treatment options with medications, and these are the triptans, which target the low serotonin levels. This can include almotriptan, elatriptan, frovatriptan, naratriptan, rizatriptan. The most commonly one here is sumatriptan, and there's zolmitriptan. There's also additional ones, Migraine, there's also a Migranol nasal spray, Cafrago, and then over-the-counter medications such as Advil migraine, Excedrin migraine, and Motrin migraine. Narcotics may be very helpful along with barbiturates and nausea medications such as Reglan, Compazine, or Phenergan. With preventive treatment options, the goal is to lessen the frequency and the severity of the migraines. A lot of these are what's called off-label medications that are FDA approved for one thing but also used for prevention of migraines. High blood pressure medications including beta blockers, calcium channel blockers, various antidepressants, anti-seizure medications, and then there's a serotonin antagonist called cenobamate. Interventional treatments, the FDA has approved Botox injections for chronic migraines. These can be administered at 3-month intervals. It's an injection into 32 sites in a 10-minute procedure. I know it sounds like a ton of sites, right, 32, but it's very quick. It's covered if certain medications have been tried and failed. For chronic migraines, which are a distinct and severe neurological disorder characterized by those who have a history of migraine and suffer from headaches on 15 or more days per month, with headaches lasting 4 hours a day or longer. So it really has to be somebody who has significant effects. Patients treated with Botox average 8 to 9 fewer headache days per month compared to baseline. This was a large study, and that was a study where the FDA approved it. There are additional procedures such as occipital nerve blocks, cervical facet injections, epidural injections, sphenopalatine ganglion blocks, supratrochlear nerve blocks, supra-infraorbital nerve blocks, and you can also do a pulse radiofrequency of the occipital nerves. In a study of 100 patients receiving greater occipital nerve blocks, over half achieved pain relief averaging 3 weeks. In a retrospective study on the efficacy of greater occipital nerve blocks in refractory migraine patients, a mixture of lidocaine and steroid was used for the nerve block. 54% of those were significantly better after the blocks, and the duration lasted up to 6 months. So that was very encouraging. Another study showed peripheral nerve blocks in the treatment of migraines, assessed 27 migraine patients looking at greater occipital nerve blocks and supraorbital nerve blocks, maximum of 10 injections with 85% effectiveness for 6 months. So these worked exceptionally well for patients for a pretty long time period. So the good news is that there are plenty of non-operative treatment options for migraines with medications and interventional procedures that can have a very high effective rate, reducing both the frequency and severity of migraine headaches. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state, accepting over 50 insurances and providing over 25 treatment options, with an average success rate of over 90% with the board-certified award-winning doctors. Visit us online today at texaspainnetwork.net or call us at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.